All right, with monkeypox cases climbing, many people looking for information have turned to social media.
Yeah, unfortunately, that's also been a significant source of misinformation or misinterpretations. Our Dr. Frank McGeorge here live with us to put some common monkeypox social media claims to our trust index. Doc.
Yeah, Kim and Jason. So let's start with a fairly straightforward one, that monkeypox came from COVID or that monkeypox is related to the COVID vaccine. Those are both not true. The monkeypox virus was identified decades ago and has no biological relation to COVID or the COVID vaccine at all. Now, here are some more monkeypox claims. One claim making the rounds is that monkeypox leaked or was purposely released from a lab. Here are the facts. According to the CDC, monkeypox was first identified in 1958 when monkeys being kept in a lab developed the infection. However, the first human case of monkeypox was identified in 1970 in the Democratic Republic of the Congo in a 9-month-old child. Since then, cases have largely been limited to 11 African countries. Although monkeypox was first identified in a lab animal, it has been present in humans since 1970. So this is not true. Another claim is that monkeypox is a disease of gay men. This is directly from the CDC. Quote, "Many of those affected in the current global outbreaks are gay, bisexual, or other men who have sex with men." Now, while this group has been hardest hit in the current outbreak, monkeypox can spread to anyone in close contact with an infected person, regardless of their sexual preferences. So this is not true. It has been said that monkeypox is airborne. Right now, I would classify this as be careful. And here's why. Right now, the most common route of spread is through direct physical contact with an infected person. This is frequently of an intimate nature. Now, the virus can also spread through objects, particularly clothing and bedding that have been in contact with monkeypox sores. However, respiratory secretions can also be infectious, specifically with close, prolonged face-to-face contact or from large droplets that you might find in a cough or a sneeze. So far, though, there is no evidence that it's airborne from any distance in the same way that COVID or the flu spread, but research is ongoing. Now, here's one more claim being circulated, that if you've had the smallpox vaccine, you are protected from monkeypox. That's actually true. In fact, the currently used vaccines for monkeypox are smallpox vaccines. Prior research suggests the smallpox vaccine is actually about 85% effective against monkeypox. The only warning would be that the last time smallpox vaccines were given to the U.S. population was back in the 1970s, and for many people, their immunity will likely have decreased.
Doc, you touched on this a little bit, but I just want to be clear on it. There's a notion that monkeypox is a sexually transmitted disease only.
Well, according to the World Health Organization, where information is actually known about transmission, just over 90% of cases in the current outbreak are related to a sexual encounter. But that leaves 1 in 10 not related to a sexual encounter. So I think the more accurate phrasing is that it can be transmitted sexually, but everyone should be aware that this certainly is not the only way that it's spread.
Right. Good information, Doc, as always. We appreciate you.